My name is Stephen Marks. I'm the founding dean of the Jindal School of Public Health and Human Development. My doctorate is in international law and international relations. I studied law at Stanford University and then pursued higher education opportunities in various universities in France and in the Middle East. I then worked for the United Nations, working in the United Nations Educational, Scientific, and Cultural Organization, UNESCO, for a decade, and then moved to foundation work and working in teaching my subject areas, which are international law, international relations, human rights, and related fields of international studies at various universities, including Princeton University, Columbia University, and for the last 23 years at Harvard University, where I was the François-Xavier Bagnoud Professor of Health and Human Rights. In that capacity, I had the opportunity to interact with some of the most outstanding leaders in the public health field, and I was very pleased and honored when I was asked to help establish this new school of public health and human development at OP Jindal Global University. We understand the meaning of this mission of our school to introduce students not only to the skills that will allow them to pursue careers in the wide range of opportunities in public health, but to do so in a way that is both global, in other words, they can work for international institutions or agencies in different parts of the world, and it is also a very significant way to apply their skills to reducing the injustices that characterize health globally. That's what we call global health justice, and it's integrally related to human development. We apply the concept of human development as articulated by Nobel Prize winner Amartya Sen as capabilities that people have to be and do what they value. So health is not just a matter of administering technology to improve the health of people who are injured or suffering from a disease, but it is to address the underlying causes, the social determinants of health that we call them, so that they may lead fulfilling lives and address their health needs, which includes physical, mental, social, and spiritual well-being. It's an enormous task, but it's a mission that we in the school seek to share with our faculty and students. And I must say that in the first years of the functioning of the school, I have been very blessed to have outstanding faculty and students who share this mission. And what we want to do now is to share the skills that our students acquire to be able to be practitioners in public health with a human development perspective to a wider range of students coming from different parts of the world. So we will try to address the expectations of students who understand public health as being much more than what you get at a clinic and from a health service, from primary health care and so on. It's much more than that. It's integrating the entire framework of services and efforts to reduce the inequalities among people and among nations so that public health can actually be a human right to everybody and they can aspire to and achieve universal health coverage. Without that, the aspiration of public health remains something that only a few people benefit from. We want all people to benefit fully from public health, and we want our students and our graduates to be able to contribute to that mission.